Hi everyone, I went in to see my neurosurgeon today and not really sure what to expect. If you don't know me, my name is Tessa and I'm a teacher, I'm a toddler mom, I own a graphic design business, and I'm the founder of Unbroken Entrepreneurs, which is a collective of business owners and small business owners, nonprofit CEOs, people who are rocking it in the professional world, but also are experiencing chronic mental health or physical health issues, disabilities, etc. And so I built that community to connect with others who are going through it, and so we could support each other. But last year around this same time, pre-COVID, I was diagnosed with Chiari malformation 1 and pseudotumor cerebri, and I have some notes down here so you'll see me looking down. Chiari malformation is essentially just a malformation of the foramen magnum, and that is the hole at the bottom of your skull which allows your spinal cord, your brainstem, to come through from your brain to the rest of the body. And in mine, my cerebellum, which is a fancy word for the bottom part of my brain that controls a whole slew of important things, basically that part of my brain doesn't have enough room, for lack of better words. My brain is literally falling out of my skull. I have too much brain for my skull, so I'm just very smart, I think. But this compression causes my spinal fluid to not flow correctly, and this could be the cause of all of my severe pain, my neurological issues that I've had. I can remember having this kind of pain since I was about 12 years old, and nobody knew what was wrong. Everyone just thought, oh, she just doesn't want to go to school, all of these things. But it is definitely the cause for the 10 out of 10 shooting headaches and brain suction cupping, I describe it as, feel that I get every time I stand up, bend over, cough, when I'm laughing, even sometimes when I look, like I'll literally look that much a certain way and my brain will feel like it's suction cupping. I'll get whiplash. So not really fun, pretty debilitating on a daily basis. The case with the pseudotumor cerebri is less straightforward because it's essentially a disorder where your spinal fluid pressure is so high that it causes pressure onto the optic nerve. It spills out into the area where your pituitary gland is. It appears like a tumor on an MRI. It's also called empty sella, if you ever have heard of this. The reason this adds another layer to my case is that it could be causing the cerebellar tonsils to be pushed down, but at the same time, the Chiari, or the cerebellar tonsils being there blocking, could be causing the pressure to go up. So it's been a long time discussing trying prescription drugs, trying exercise, trying different eating, trying all of these things. Meditating, I've tried CBD, I've tried THC, I've tried everything, and nothing has really made a difference to my pain, my overall issues. It obviously doesn't fix anything. It might temporarily subdue something. So after a lifetime of doctors being jerks, I've had misogynistic doctors, I've had egotistical nightmares, and neurosurgeons are supposed to be experts, right? That doesn't necessarily mean that they have the best bedside manner, but having a good bedside manner is not just listening to your patients. Like, that's not what I'm asking for. I do want an expert in this. And I did find an expert surgeon who's done thousands of these surgeries. He actually asked me if I myself was a doctor or in the medical field because he said I was the most sophisticated patient he's ever talked to. I know more about this disorder and these procedures than a lot of his colleagues do. So that felt really good that he was not only just listening to me, but that the research I had done and the anxiety I'd poured over this was worthwhile. So I basically was like, nope, I'm just an advocate for my medical issues because no one else really was. But so all of this to say, I am scheduling Chiari decompression surgery. It'll be within the next couple of months. I'll quickly go over how this surgery goes. So if you don't really care about the medical side of things, if you don't want to listen to surgical procedure talk, click off now. Basically, I go in and they prepare me. I get put under. They will shave the back of my head, like about an inch wide, about 4 inches tall of shaving. And then they do a skin incision of about 3 inches. and the skin and the muscles are pulled apart, spread apart, folded back, and the surgeon removes about a 3 centimeter by 3 centimeter portion of the skull at the back of my head. This is around the foramen magnum, so the hole that's already there, they just expand that. Then they'll also likely remove the back portion arch of the C1 vertebrae, so that's the very first top vertebra that you have in your neck. And the surgeon will then open the dura, and the dura is the protective covering of the brain and spinal cord. So it's just like a second skin within your skull that protects your brain. And a patch is then sutured into place on the dura to allow it to be a little more spacious for the cerebellum, for your spinal fluid to flow freely in there. And then that is sealed to prevent leaks. So the biggest concern, obviously anesthesia is a concern. It's a pretty low risk surgery though. And the biggest concern after would be CSF leaks, which isn't very common, but it is something that happens. Pretty low risk surgery. My surgeon and another surgeon I've talked to talk about people with my MRI results and the symptoms that I'm having. About 70% of patients are seeing an improvement in symptoms, and about 30% of patients are not seeing anything change. There are obviously those rare cases. Those things are risks, but beyond that, it's a pretty low risk surgery. And honestly, 70-30 is pretty good odds to me. I had terrible symptoms, progressive symptoms that have gotten worse since I was 12 years old, and even probably before that, is pretty good odds to me. And I'm a realist, so thinking about I'm kind of like, I'm going to expect it not to do anything so that when it does, I'm pleasantly surprised. And for my own mental health, that's what works for me. And the recovery time can be anywhere from 4 to 8 weeks. Typically 4 to 6 weeks is what you're looking at. And within a lot of that time, there will be no lifting, no housework, no like getting up and doing things around the house is not part of that. You slowly start to build that in, and you're doing neck stretches and all of that stuff so that your neck muscles aren't super tight after that surgery. So it is going to be a rough recovery for sure, but the possibility of having some symptom relief is a really good thing right now, and just having a doctor who was willing to listen to me. So all this to say, if you're still listening and you are someone who experiences physical or mental health issues, like please advocate for yourself and find yourself the right doctor, the right therapist, the right spouse, the right partner, the right friend, someone to support you, even if that's just being a sounding board. Because when I went into this neurosurgeon, I was like, you know what? I don't even care if he tells me the complete opposite of what I want to hear. As long as he's a kind human being and listens to me and is willing to listen to my side and my research and my symptoms and all of this stuff. Because I mean, I had 2 pages worth of circled symptoms. I was like textbook before I even had the MRI that this is probably the cause for it. Yeah, just find yourself a support system. For me, I'm feeling really good. I really wanted this. I think that this is the great next step for me. And I'm really excited to see what happens in the next couple of months. I will keep you all updated. Thank you so much for listening. Please feel free to DM me if you are going through this, if you have had Chiari surgery or you're thinking about it. Obviously, nothing I said is medical advice, and I can't give you medical advice, but I can definitely be a sounding board for you. If you are interested in joining Unbroken Entrepreneurs on Facebook, where we talk about our medical visits sometimes, and I definitely post when I need support and others post when they need support. We give each other a really good support system if we don't have that outside. I am very lucky to have an amazing family and my husband who takes amazing care of me anyway, ready to support me for whatever my next step is. And so I will keep you updated when I schedule that surgery. Thank you so much for listening, and let me know if you have any questions.